Do you give consent for this video?
Yes.
Okay. My name is Caitlin and I will be your nurse today. Can you tell me your name and date of birth?
Kylie Jensen, 8/29/02.
Okay. Today, basically, we're going to be doing a general assessment of your head to your abdomen, and I'm going to be listening to your lung and abdomen sounds. Can you tell me if you have any pertinent medical conditions I should know of?
No.
Do you have asthma or COPD?
Mild asthma.
Okay. And at this point, I would wash my hands, provide privacy and gloves if necessary. And can you tell me your name again?
Kylie Jensen.
Can you tell me around what time it is?
8 o'clock.
Can you tell me where you're at?
Your house.
Can you tell me who the president is?
Joe Biden.
She is awake and alert and she is oriented ×4. And how are you feeling today?
Good.
And her behavior is, she's in a good mood, and her behavior reflects this because she appears to be content and calm, and her appearance is appropriate and clean and well groomed, and her speech is clear and articulate. And now moving to her head and face assessment. Her skin is a beige white and I don't know any lesions. It is intact and it has a little bit of pink undertones. And then looking at her hair, it's evenly distributed and clean and well groomed, and her ears, eyes, and nose are all symmetric and in line with each other. And can you smile? Can you raise your eyebrows? Can you puff out your cheeks? Okay, so her facial movements are also symmetric and they all move together, which is normal. And then looking closer at her eyes, can you pull down your lower lids? And then can you look around the room? So her sclera is white, her conjunctiva is clear, and I noted minimal veining, and I can see that her pupils are round, and then they're about 5 millimeters and equal. And now I'm going to assess them with their reactivity to light, indirectly and directly. So look straight ahead. Okay, so directly both the pupils constricted, and now I'm going to look at them indirectly. Okay, they both constricted again indirectly with light. Now I want you to focus on the tip of this pen light. Okay, and her eyes converged and her pupils again constricted. And now I'm going to assess her cranial nerves using the positions test, and this test assesses the 3, 4, and 6 cranial nerves, which are respectively oculomotor, trochlear, and abducens. And I want you to just focus again on this tip of the pen light. Okay, so her eyes move together and follow the pen light exactly, and there was no strabismus or nystagmus. So now I'm going to look at her mouth and throat, and her lips are pink and they appear to be moisturized and intact with no lesions or exudate or drainage. And can you open your mouth? Okay, so her teeth were white and I do not know any missing teeth, but they did have a little bit of dental work. And do you have any dentures?
No.
Okay. and her tongue and throat and buccal mucosa and hard and soft palates were all pink and moist, and I did not know any lesions or exudate or drainage. And now I'm going to look real quickly at her tonsils with the tongue depressor. And you can say ah. Okay. So her tonsils I would grade a 1 because they are not touching, and I also did not know any exudate or drainage on those either. And they were pink, well, and they were of good color and no lesions or exudate. And now I'm going to assess her neck. Can I palpate your neck?
Yes.
I did not know any swelling or masses, and the trachea was midline. And looking at her position, she's upright and in a tripod, not in a tripod position, and she's using room air to breathe, and no accessory muscles such as the sternocleidomastoid or trapezius. Okay, so now you can turn your back towards me so I can look at her posterior thorax. Okay, so her spine is midline and straight, and now I'm going to look at her chest expansion. And I want you to take a deep breath. Okay, so her lungs moved upright bilaterally about 1 centimeter, which is normal upon breathing. And now I'm going to listen to her lung sounds. And every time I move the stethoscope, you can take a deep breath. Wait, sorry, I meant over here. Okay, so her lung sounds were clear bilaterally, and I did not know any crackles or wheezes. Okay, and you can turn towards me again. Okay, I'm going to do the same thing on this side. And can you move your bra and displace your breasts? Okay, her lung sounds on the anterior side were also clear bilaterally, and I did not know any crackles or wheezes. Now I'm going to assess her abdomen, so you can lay down. Okay, you can position yourself. So, okay. So her abdomen is symmetric and flat and non-distended. And looking at it, I only note one lesion in the form of a secondary lesion, which is a belly button piercing. And looking at her umbilicus, there's no redness or exudate or drainage, and it is inverted. Can you move your arm, this arm a little bit? Okay, thank you. And now I am going to auscultate, and I'm going to start in the right lower quadrant if you have no pain. Do you have any pain?
No.
And if you did have pain, I would make that quadrant the last quadrant that I listened to. And I'm going to move in a clockwise fashion. Okay. Her bowel sounds were active about 8 times per minute, which is normal within the range of 5 to 30. And I heard soft clicks and gurgles. And now I'm going to palpate her abdomen. Do you have any pain before I begin?
No.
Okay, I want you to let me know if you feel any pain. And I'm going to start in the same right lower quadrant and go in the same pattern. Okay, so her abdomen was soft. I did not know any rigidity or distension or guarding, which is normal. And you can sit up because I'm going to do a kidney percussion on her back. And I'm going to do this over her lower rib cage. I'm going to place one hand here and then give you a strike on the back. Before I begin, do you have any kidney problems?
No.
Okay. Did that hurt?
No.
Do you feel any pain?
No.
Okay. So that concludes the assessment. And now I would put the patient back in a comfortable position, lower the bed, place call light and personal items in reach, put the side rails up, and document my findings.